Did you know that there is a huge range in relapse rates in OCD? It seems that every study I read reports OCD treatment relapse anywhere from, maybe 20% in this study to 60% in another study. So I'm going to explain what's going on here and try to give you some tips on treatment to maintain your treatment gains and help you sustain your recovery from OCD. Hi, I'm Paige Pradko, a therapist that specializes in treating people with anxiety disorders, OCD, and health anxiety. Welcome to Therapy for a Better Life. Now, before I get right into it, I left you some free gifts in the description of this video. A link to a free self-assessment for OCD, and a PDF called The Top 10 Things You Need to Know to Practice ERP, Exposure and Response Prevention for OCD, Phobias, and Anxiety. Now, obsessive compulsive disorder does require specialized treatment, and there's a few different modalities that are what we call evidence-based or proven methods through extensive trials and research. ERP, exposure and response prevention, is at the moment the most researched model of treatment that we have. But what we don't have are lots of long-term research studying people with OCD over the course of their lives to find out really what, did they relapse? And if they did relapse, why did they relapse? Are there any risk factors to relapse? So the longest follow-up study to date is a 40-year follow-up study of individuals treated for OCD in Sweden by Skog and Skog. So here's the scoop from the Skogs. Improvement overall was observed in 83% of the 251 individuals in the study over 40 years. But fewer than half had completely recovered from OCD. Only 20% had completely recovered with no symptoms at all, and another 28% had some symptoms, but their symptoms were not deemed clinically significant. That means that their symptoms didn't interfere or affect their lives, all that much. But the other participants did experience symptoms, and they did experience periods of relapse. Their OCD symptoms came back after treatment. Now, as a therapist who treats people with OCD, I want to know more. I want to understand exactly what the risks are for relapse so that I can do everything I can to target those risks in treatment. Dr. Jane Eisen and colleagues published in the Journal of Clinical Psychiatry in 2022 an article about relapse in OCD and cited studies like the Skog study that show that people that stop short in treatment before achieving full remission are more likely to relapse. In other words, if you're doing ERP or any other method or combination of treatment methods, and you stop short of successfully treating all of your symptoms, then you're going to be at more risk for relapse. Now, this is actually quite common in OCD treatment. I have had several clients decide to stop short. They report that they're happy with their progress that they've made. And their life is a little bit better, a little easier. But often something else is going on here. They're not quite ready, maybe, to work on some of their most challenging compulsions. So according to the research, partial remission is the #1 predictor of relapse. So if you want to make sure that your goal is full remission, or get as close to that as you possibly can in therapy, dabbling in ERP or dabbling in any other treatment methods with a little bit here and there doesn't predict lasting results. You'll have a better chance at maintaining your gains if you go after full remission in your treatment. You can still control how fast you move through treatment. You can take your time, you can make progress kind of step by step, but committing to be all in and work to achieve full recovery is really what's recommended. Now, as a specialist in OCD, I never want to let a client go that hasn't achieved full remission. But when someone is just dabbling in treatment, they're not fully committed, maybe they're not doing all their homework, they're canceling sessions, I think that treatment can actually do more harm than good because their treatment will not result in remission and their risk of relapse is so high. Then they can conclude actually that that treatment modality doesn't work for them, which wouldn't necessarily be true, and they lose confidence in themselves and therapy and OCD treatment. So I try my best to avoid this scenario in treatment. It's better, in my opinion, to wait until someone is fully committed rather than dabble a little bit here and there in treatment. So in my OCD course, I teach several methods to help you sustain full recovery. You'll learn an easy 3-step process on how to do ERP and tailor it to your fear or discomfort or disgust. And you also learn a global method of treatment to maintain your gains and help prevent any relapse. Now, the next predictor of relapse, according to Anthony Pinto and colleagues in 2011, are people who not only have OCD, but also have OCPD, Obsessive Compulsive Personality Disorder. We use the term comorbid, and that just means that you have met the diagnostic criteria of both disorders. So obsessive compulsive personality disorder is when someone has a preoccupation with orderliness or perfectionism and control at the expense of being flexible and open. OCPD typically begins in early adulthood, and these are people that are preoccupied with rules, details, lists, and order and organization and perfectionism. They might work excessively to the exclusion of leisure time or friendships. Sometimes they might be unable to discard like worn out or worthless objects, even when it has no sentimental value. And they might have a hard time delegating tasks. Some of them might have miserly spending styles, and they're rigid in their particular areas of concern. So they often like their rules and perfectionism and rigidity, and they don't necessarily want to change, even if it has a negative effect on their relationships. So some people with OCD and OCPD were twice as likely to relapse if they had them both together. And the main culprit is actually having the trait of perfectionism. So what Anthony Pinto suggests in his research is to target and include treatment for OCPD when someone has both OCPD and OCD, especially if there's perfectionism involved. Now, other predictors of relapse include age of onset of OCD and the symptom severity. So the earlier age that you experience symptoms and the longer time that you had symptoms before treatment, and the more severe your OCD is, the more difficult it is to treat, and the more likely you will experience some relapse. I don't want this to discourage you. It just means that you may have to continue treatment longer than those that have less severe symptoms. But here's a bit of good news. For those of you that experience harm-themed OCD and have obsessions regarding and maybe an over-responsibility of harm to yourself or others, you actually fared best in the studies. Your theme is a predictor of achieving a successful recovery and sustaining remission. I noticed this in my practice, just how fast and successful my clients got better when experiencing harm themes. So it's great to see some good news coming out of research. To review, relapse is prominent in OCD treatment. You can reduce your relapse if you fully commit to treatment and continue treatment until you're in full and complete remission with no symptoms or very few symptoms. You don't want to stop your treatment short. And if you have both OCD and OCPD, you will need to treat both conditions in treatment. If you have perfectionistic traits, you're especially at risk for relapse, and you're going to need to target perfectionism in treatment. So I left you a few gifts in the description of this video. And if you need help with your OCD, I have an online course available at paigepradko.com. Please leave me your comments and questions below. I would love to know how you're doing. So until next time, I will see you in session. Take care. Bye-bye.